My name is Andrew Wolfe. I'm a board-certified plastic surgeon in Denver, Colorado, focusing on cosmetic plastic surgery. Given that we are located in Denver, we are surrounded by significantly smaller cities, and Denver really is an excellent place to fly to for surgery. We've got a significant web presence. We've been doing this for a very long time, and we have a lot of patients, and it's natural for people to want to find a center of excellence to have surgery. And so very commonly we will have people contact us from points either within driving distance but farther away, or areas from which they have to fly. And so it's very, very common that people want to know how they can contact us. How does that consultation and surgical process work if they don't live in Denver? It's something our staff is very, very used to dealing with. And so as the first point of contact, any one of our front staff or the patient counselors can help illustrate how that works for a given patient. But typically somebody will call or email the practice, get put in touch with one of the patient counselors, who really is the concierge that will take the patient from scheduling through the consultation, through all the financial attributes of the surgery, and the postoperative course as well. And so very commonly there is a consult either by phone or by Skype with the patients. If it's going to be by phone, typically the patients will email us photos to our secure email. That way we can get a sense of what the patient looks like to start, what might they have in mind surgically, whether it's face, breast, or body. We spend a significant amount of time on the phone with patients or doing a Skype consult. Skype can be very helpful, especially for facial surgery, because obviously being face-to-face has an advantage relative to just talking to someone. Once we have figured out whether the patient's a good candidate, what they might have in mind surgically, they can go ahead and schedule with one of the patient counselors. Very commonly the patients will fly out several days prior to their surgery. Most patients will have either a friend or family member in town, although certainly that's not required. And patients may fly out with a friend or family member who stays with them during their stay here in Denver. If someone is going to be having a breast augmentation surgery, it's important that we see them a day or two prior to surgery so we can do all of the sizing for breast implants required to pick the right implant. We want to make sure that we have the right implants on hand for that patient during the surgery that they choose. They will have surgery, go back either to their friend or family's house or stay at a hotel with a friend or family member. There's a number of hotels in town that we have agreements with. On occasion, nursing care may be provided for them depending on the size or the scope of the surgery that they undergo. We will see them for their postoperative visits as normal, whether it's 1 day or 3 or 4 days after surgery. Typically at the end of a week, many patients are up and about and feeling pretty good. That's not an uncommon time for patients to fly home. If it's a more significant surgery, sometimes 2 weeks may be asked of them here in town just to make sure that they're really able to travel safely and head back home.